Hello, welcome back to the Mental Aware podcast, where we explore the complexities of mental health and empower our listeners with knowledge and understanding. I am your host, Isaac Ogun Shaitan, and today's episode is titled Pharmacological Treatment of Bipolar Depression. We will dive into the various medications available for treating bipolar depression, discuss their dosing, and highlight the importance of individualized treatment. Bipolar depression is a complex condition that requires a tailored approach to treatment. There are numerous medications available, each with its unique dosing guidelines. Let's discuss some of the most commonly prescribed medications for bipolar depression. Lithium. This medication is often considered the gold standard for treating bipolar disorder. Typical dosing range for lithium is about 900 to 1800 milligrams per day, and it can be taken once at bedtime to mitigate some of the side effects associated with this medication. Blood levels should be monitored to ensure safety and efficacy. Valproate or Depakote is another classic mood stabilizer that is effective in managing both the depressive and the manic episode. The usual dosing range is about 1,000 to 25 milligrams per day, divided into 2 doses, or it can be taken once daily based on how the patient tolerates it. But I must mention that these two medications carry a fatal risk. So you have to be very careful, especially in patients or women of reproductive age. Quetiapine is an atypical antipsychotic that can be beneficial for patients with insomnia as a predominant symptom. The typical dose for bipolar depression is 300 milligrams nightly, and I have also seen patients taking about 400 milligrams, to help with their symptoms. Lurasidone or Latuda is a medication that is specifically approved for bipolar depression by the FDA. The recommended starting dose is 20 milligrams, which can be increased to a maximum dose of 120 milligrams daily, depending on the patient's response. But I must mention that it has to be taken with food to help with its absorption. Caplyta or lumateperone is a newer medication, and this medication has shown promise in treating bipolar depression with fewer side effects, less risk for weight gain, and I think this is based on its pharmacology as it is more serotonergic. The recommended dose for lumateperone or Caplyta is 42 milligram once daily. And there is also a 21 milligram capsule that can be utilized for patients who cannot tolerate the 42 milligram pill. Antidepressant should be used with caution in patients with bipolar disorder, as they can sometimes trigger manic episode. It is very essential to combine them with a mood stabilizer or atypical antipsychotic, and they should be given at a lower dose when utilized in patients with bipolar depression. Preferably, bupropion is a good choice compared to SSRIs or SNRIs like venlafaxine, sertraline, or fluoxetine. And talking about fluoxetine, there is a medication approved by the FDA, the fluoxetine or olanzapine combination for treating bipolar depression. It's a good choice too. But this medication carries significant weight gain risk. So this has to be taken into cognizance. Though there is another medication, Lybovi, which is a combination of olanzapine and samidorphan. It has a less risk for weight gain compared to the olanzapine and fluoxetine combination. It is essential to work closely with a psychiatrist to determine the best medication and dosing for your specific needs. They will carefully consider your symptom, medical history, and any potential side effects when prescribing a medication. Remember that individualizing pharmacological treatment for bipolar depression is critical part of managing this complex condition. By being open about your symptoms and any medication side effects, you can find the best possible treatment for your unique situation. Thank you so much for joining us today on the Mental Aware podcast. Be sure to subscribe for more insightful discussion on mental health. Until next time, take care and stay mentally aware.